Good morning, everyone, and fantastic that so many of you could join us today for our webinar, which is 1 year on the impact of COVID-19 on the lives of people approaching later life. My name's Claire Turner. I'm Director of Evidence here at the Centre for Ageing Better. So before we get started, I'll just go through a kind of few housekeeping things, which is the norm, isn't it? Well, now we're all on Zoom. We're going to mute all attendees throughout. We've already had some advanced questions, which is fantastic. And we know that whilst you'll all be listening very intently to the presentation, it would be great if you could also be thinking about any questions that you might have for the Q&A part of today. So you'll see along the bottom of the screen, there is a chat function, but we would like you to put any questions in the Q&A box. So if you click on that Q&A button, if you've got a question that you'd like to ask any of our panelists today. And so only questions that are in there will be picked up by me. We know from previous events there'll be lots of questions, and we'll do our best to answer as many as we can, but we know we won't be able to answer all of them, I'm afraid. We're also going to be recording today's webinar, and it will be made available to watch on our YouTube channel. And with that kind of on-demand video, subtitles are available should people need them. If you are watching this on demand and you'd like to join in a kind of extended conversation online about what we talk about today, then please use the hashtag #AgingBetterEvents. So I think this has definitely been a week where we've all been reflecting. It's been over a year since the Prime Minister announced the first national lockdown in response to COVID-19. And at Ageing Better, sort of since that time, we've commissioned research across all of our areas of work, across health, housing, work and communities, to look at the impact of the pandemic on people approaching later life. And in the last 12 months, we've seen how the cumulative effect of the virus and the kind of various lockdowns and restrictions, how that's really exacerbated existing inequalities, again, across people's health, across their working lives, their sense of community, and it's really highlighted some of the great shortcomings of the homes that we live in. So in today's webinar, Aidine's going to give you an overview of the kind of findings from across these research projects, and we're also going to show a short case study video. And then that will be followed, as I said at the beginning, by an opportunity for questions and discussion, where we'll be joined by some other colleagues from Ageing Better. So I think let's crack on. Without further ado, I'm going to introduce Aideen Young. She's an evidence manager at the Centre for Ageing Better, and has both been involved in some of the research projects that we've commissioned, but also has done a fantastic job of kind of bringing together the work that we've done across the last year. So Aideen, over to you.
Thank you very much, Claire. Good morning, everybody. Okay, I'm going to share my screen and we'll just crack on. Okay, is that working? Claire, yes, good. All right, fine. So we'll just crack on. As Claire said, we've done research across our 4 priority goal areas on aspects of work, communities, health and homes pertinent to our cohort of indigenous people aged 50 to 70. And I'm going to start with talking to you about health. So of course, as we all know, COVID-19 was first seen as the great leveller, equally affecting people regardless of status across society. And of course, it soon became apparent this was far from the case, and that its impact varied quite profoundly by a number of characteristics. One of these, of course, was the presence or absence of pre-existing health conditions. And this slide shows the proportion of deaths involving COVID-19 by main pre-existing condition between March and June last year in England, among people of all ages and people aged 50 to 69. And really the point here is that only among people aged 50 to 69, just 12% of deaths in people with COVID were in people who had no pre-existing health conditions. Of the more than 50,000 deaths that happened over that period, 91% were in people who had at least one pre-existing health condition. The average number of pre-existing health conditions that people who died from COVID had was 2.3. Now, why am I showing you this? Because this data demonstrates very clearly how important it is that we take a preventative approach to our health. If our burden of poor health had not been so bad, then our outcomes from COVID would not have been so dire. A preventative approach to our health means addressing the risk factors for poor health, and those include the behavioral risk factors for poor health, which include alcohol consumption, physical inactivity, poor diet, and what have I not said? Okay. Yet, at the same time as we realize the need for a preventative approach to health and to address these risk factors, we know that our health behaviors have actually deteriorated. So one of the first projects we undertook was one with Ipsos Mori to examine how people aged 50 to 70 have experienced the pandemic. And the study entailed a nationally representative survey of 1,000 participants aged 50 to 70 and longitudinal qualitative research. And when asked how their behaviours in July 2020 compared with pre-lockdown, we found that 32% of 50 to 60-year-olds have been drinking more, 36% were smoking more, 29% were eating less healthily, and there were similar patterns for physical inactivity. Now, while some people had managed to make some positive choices, such as eating together often as a family and more physical activity, those proportions were small. And so the overall pattern is one of worsening health behavior. This research also showed that over half of 50 to 70-year-olds surveyed had a medical or dental appointment delayed or cancelled. 20% have had a routine medical appointment delayed or cancelled. GP appointments have been delayed or cancelled. And for many, there is great uncertainty and worry about the rescheduling and the longer-term impact of this. It doesn't seem like a push to suggest that those delays and cancellations will impact most people who are in poorer health to begin with. And indeed, the research from that same study conducted by Ipsos shows that on the left, you can see there 23% of people say that their physical health is a little or a lot worse as a result of the coronavirus pandemic, and that's not necessarily because they caught the virus. But on the right-hand side, you see in that little box there, there are some other characteristics that make that even worse again. So if 23% of the total population say that their physical health was a little or a lot worse, the proportion was twice as large among people whose mental health had deteriorated. Living in a housing that doesn't meet your needs was a contributing factor, as well as financial and employment worries. But importantly, too, there you can see that 42% of people with existing poor health said that their health had been negatively affected by the coronavirus pandemic, twice the proportion in the overall population. And what that means, of course, is that the people whose health was poor to begin with have differentially seen a deterioration. So we can expect this to mean increasing health inequalities. Another big project that we undertook was one with NatSen, when we commissioned to conduct a study that comprised 2 surveys of adults across England with a boost of people in our age cohort, 50 to 69. One survey was in July and one in November. And this data is very consistent with that of the Ipsos. So people were asked to say to what extent the pandemic had had a very or fairly negative effect on various aspects of their lives. And so of all adults, 39% of people aged 50 to 69 shown here, and 56% in that age group said that the pandemic had had a very or fairly negative effect on their physical and emotional health. But when we look at this data by subjective socioeconomic status, that is to say, whether people feel they're living comfortably or they're struggling to get by, we see very stark differences. So you can see here that about 28% of people aged 50 to 69 who are living comfortably say that the pandemic had had a very or fairly negative effect on their physical health, and 44% of that group said the same for their emotional health. But here are the people who were finding it difficult to get by. The proportion of that group for whom the pandemic had a very or fairly negative effect is twice as large. So that's really very stark, and a very stark illustration of how the pandemic has had an extremely unequal effect across the population. Okay, so now that is how health. Will now move on quickly into housing. So we've reported this stat for quite some time, that of the 23.5 million homes in England, we know that 18%, that is 4.3 million, are in a non-decent condition. They do not meet the 4 standards set by the government to be considered decent. That it means free of category 1 hazards, in a reasonable state of repair, with reasonably modern facilities, efficient heating, and effective insulation. Now, why do I tell you this? Because we know that the state of our homes impacts our physical health and well-being. This report, which we produced with the King's Fund, brings together all the existing evidence on the association between our homes and our health. Poor quality homes, those that are in physical disrepair, are cold and damp or inaccessible or of an inappropriate size, are associated with a range of negative health outcomes. And those include cardiovascular and respiratory conditions and a decline in general physical and mental health. And of course, groups who experience health inequalities anyway are disproportionately represented in these homes. That includes people with older adults, people with long-term health conditions and disabilities, Black and ethnic minority groups, and low-income groups. And so these poor quality homes simply compound their disadvantage. Poor housing is estimated to cost the NHS at least £1.4 billion per year. And speaking of homes of an inappropriate size, we know that around 300,000 people were living in a home that consisted of 1 room during lockdown. Overcrowding, as we know, is associated with increased transmission of the virus, and that is more common among ethnic minority groups. 30% of Bangladeshi homes, 18% of Pakistani experienced overcrowding compared with 2% of white British households. A very stark statistic here, that of the 20 local authorities with the highest COVID-19 mortality rates, 14 also had the highest percentage of households living in overcrowded homes. So non-decent homes, so COVID-19 has exacerbated the link between health and housing in 3 ways. Firstly, non-decent homes are associated with the underlying conditions, health conditions, that increase the risk of poor outcomes from COVID-19. Overcrowded homes have led to increased transmission of the virus. And the lockdown measures taken to control the virus have caused those living in the poor housing to be exposed to the very conditions that put them at risk of poor health and poor outcomes in the first place. In the NatSen panel study that I referred to, people across the country were asked what aspects of their home they'd find particularly difficult during lockdown. And overall, all 50 to 69-year-olds, the most common issues were noise, inadequate internet connection, and lack of privacy. But some striking differences according to tenure type are shown on this slide. We've got various conditions that people find difficult here. People reporting, was it too cramped, no outside space, and so forth. And the blue bar is social renters, the orange are homeowners, and the green are private renters. And you can see, let's just look particularly at the two things at the bottom, people complaining of lack of privacy from neighbours and noise levels. You can see that lack of privacy was an issue for 20% of social renters, but fewer than 1 in 10 of the other tenures. And similarly, noise levels were an issue for almost a quarter of social renters and fewer than 10% of the other tenure. Okay, so that's a little snapshot of data on homes. And now this is our third priority goal area, connected communities. And the data that I'm going to show you here comes from the Ipsos Mori research that I've just talked about, the NatSen research that I've also talked about, and then a third piece of work going on in Manchester, which I'll mention now in a minute. So the Ipsos project highlighted the various ways that people have been helping those around them. I mean, and there's been a lot of talk about the fact that communities have really pulled together and significantly filled gaps left empty by government. And they've been helping people running errands and shopping and providing people with meals, and it's been really very encouraging. This is from the Ipsos study. 30% of people aged 50 to 70 volunteered informally, and of those, 87% said they'd like to continue. The data from the NatSen panel study was very similar, with more than a third of people reporting that they've been involved helping in their local area. But the NatSen data, which is the data where we can look at people according to whether they say they're living comfortably or finding it hard to get by, as well as objective measures of socioeconomic status, that data showed a socioeconomic disparity in who was doing the helping out. So whereas almost a third of those who feel they're living comfortably provided help with shopping for neighbours, this was the case for just 16% of those who are finding it hard to get by. The NatSen panel study also looked at sense of belonging. And it showed that those who have a sense of belonging to their neighbourhood are much more likely than those who don't, who have helped others in various ways. So this chart shows people aged 50 to 69. It shows various ways that people did helping others in their neighbourhood. The green bar is the proportion for people who agree that they have a strong sense of belonging in their neighbourhood, and the red is for people who disagree with that statement, that is to say they presumably feel they don't have a strong sense of belonging. And so you can see that for all of these types of helping, except for the bottom where you did not volunteer during lockdown, and for that one, a higher proportion of people who don't have a sense of belonging, didn't volunteer, than and people who did have a sense of belonging. For example, the most stark one there is that, while almost a third of 50 to 69-year-olds who agree that they have a sense of belonging to their neighbourhood provided help with shopping, that third set of bars from the bottom up, it was the case for fewer than 1 in 10 in this age group who didn't have that sense of belonging. Now, there's no, it's not that one thing necessarily leads to the other here, which comes first, but it's almost certainly the case that sense of belonging and helping out are mutually reinforcing phenomena. Looking a bit more at this phenomenon of belonging, data from that first wave of the NatSen panel study in July 2020 showed that more than half of all adults did have a strong sense of belonging in their neighbourhoods during lockdown, and it increased with age, so more than 3/4 of older people. But it varied by how well off you are, which is shown here, with more than 70% of people who living comfortably saying that they feel they have belonging in their neighbourhood, this proportion declines stepwise as you go down this subjective socioeconomic scale, reaching about 44% of people who find it difficult or finding it difficult to get by. So about 73% versus 44%. And we also saw that same sort of trend in a number of other measures of kind of connectedness, like, you know, do you know people you could count on to help out? Do you know people to say hello to? Do you feel trusted of neighbors, and so on? So we saw that over and over again. And the experience of lockdown increased levels of connection in our communities, shown here. People were asked, do you feel a greater sense of belonging now than you did before lockdown? And it's shown here the proportion who say yes to that question, and it obviously increases by age, to 3 in 5 people aged 70 and over. And again, we see that trend with other measures in that data set, like do you know more people you can count on, and so forth. People reported, yes, they felt more connected on these various measures since before lockdown. On all of these measures that we looked at for connectedness, not only did people, more of those who are living comfortably, the better off, not only did more of those feel more connected to start with, but more of them saw a bigger improvement. They became more connected as a result of the experience of lockdown. Here you see the proportions of people who are living comfortably, who'd say now they know more people they could count on. They are more aware of local voluntary groups. They know more people to say hello to. They have a greater sense of belonging to their neighborhood. So that's the living comfortably people, age 50 to 69. And there are the proportions for the finding it difficult to get by. So quite substantially less. And, you know, given that we don't feel connected on our own in our communities, it seems reasonable to assume or conclude that this might mean that levels of connectedness have increased in places where people are in well-off places, where there was already high levels of connectedness, and that there's been much less change in places where people are struggling to get by and where levels of connectedness may have been lower to start with. And so in that way, the experience of lockdown may have increased inequality in actually the way in which people experience their communities. Now, that was lots and lots of charts there and lots of data. So just now to bring a little bit of a human dimension to all of this research. This is the third piece of research that I referred to at the beginning. Since March 2020, along with some organisations in Greater Manchester, we have funded the Manchester Urban Ageing Research Group to conduct a project looking at the lived experience of vulnerable people aged 50 and over in deprived areas of the city. And so we've got people who are living alone, people who are housebound, BAME people, LGBTQ+, and these are people living in areas of multiple deprivation across the city. I'll give you just a couple of minutes to read those quotes yourself. Just a minute.
Aideen, I'm just letting you know you've got about 5-7 minutes left.
Okay, I better gallop on then. So just to say that this work has, you know, really highlighted the impact of social distancing on everyday lives and relationships, as illustrated by these quotes, and has illustrated just the role that BAME community groups have played in providing social connections and support for older people, and how the closure of services during lockdown has increased social isolation for many. So I'll just move on. Another quote here, the same from that same piece of research. You can read it there, but it illustrates the reciprocity that's inherent in giving and receiving support, and how new relationships were created in these exchanges of support. We saw too in this the importance of faith-based organisations and the profound impact that the loss of those organisations had on people's daily life. To summarise this bit on communities, we would say that the pandemic is likely to have reinforced divisions between older populations who are, between those who are relationship rich and those who are relationship poor, and that building back support for community organisations, networks and support services is going to be critical. All right, finally, work and finances is the final section of the presentation. We have been seeing increases for a prolonged period of time now in the number of older people in the workforce, which is, of course, what we at Aging Better have wanted to see. But the pandemic has been rather harmful to this this trend. After 18 to 24-year-olds, older workers are experiencing the greatest falls in employment. There are now 143,000 more people aged 50 to 64 out of work than there were last March. We commissioned the Learning and Work Institute to look at how the pandemic will affect the job prospects of older workers. And they have found that the number of 50-plus workers seeking unemployment has doubled during lockdown to more than 610,000 in October 2020. Now, why does this matter so much to us? It matters because we know that over 50s who are unemployed are twice as likely as those under 50 to be out of work for 12 months or longer. And these statistics on unemployment are reflected in older workers' frame of mind. The Ipsos research found that around 7 in 10 people aged 50 to 70 who are currently workless do not feel confident that they will be employed again in the future. And 1 in 4 of furloughed workers in that age group think the same. The concerns of older workers in that Ipsos work are echoed by those found in the Learning and Work Institute project. The barriers that older workers say they face returning to work are skill gaps in applying for jobs. One person was unsure about how they would find a job because it had been over 2 decades since they'd had to do so. There are concerns about developing new skills to transition to new sectors post-COVID, particularly true for sectors such as travel that have been so hard hit. People very concerned that their sectors wouldn't survive or would be unrecognisable. Some participants would like flexible work in order to continue balancing caring responsibilities. And the stereotypes of older workers are seen as a major challenge, and many are concerned that this has been exacerbated by the whole age narrative during the pandemic. And that has in turn, those stereotypes have in turn impacted the confidence and aspirations of people, of older workers seeking work. People are very pessimistic too about their financial prospects. The research conducted by Ipsos found that 2 out of 5 older workers and 2/3 of the self-employed are concerned that their finances will get worse as a result of the pandemic. And lockdown and uncertainty about future work prospects in this work from the Institute for Fiscal Studies shows that a lot of older workers have now started to evaluate their retirement, their job priorities and their lives moving forward. So we find now that a significant minority of older workers who were working immediately before the crisis have now retired. And 1 in 8 older workers have changed their retirement plans as a result of the pandemic, with 5% planning to retire earlier. That tends to be those who are wealthier and or furloughed, and 8% planning to retire later. That tends to be those who've seen their pensions value decrease and or they're working from home. Now that latter is interesting because we know that occupations requiring higher qualifications and more experience are more likely to be those that provide home working opportunities over elementary and manual occupations. So the option to work from home, and if it continues long term, will likely advantage older workers who are already better off. And that could potentially increase disparity between the occupational classes. This is my last slide, Claire. So going back to the NatSen work, as I said, there were 2 surveys. The second was in November, and again, as I said, people were asked to say what extent this pandemic had had an effect, ranging from very positive to very negative, on various aspects of their lives. And here we see what people say, the proportion of people aged 50 to 69 for whom the pandemic has had a very or fairly negative effect on financial security, work security, and satisfaction with my home. And these purple bars are for the people who are living comfortably. So you see the proportions there. And now I'm going to put up the proportions of people aged 50 to 69 who are finding it difficult to get by. And those are the proportions for whom the pandemic has had a very or fairly negative effect on those aspects of their lives. So huge, really enormous disparity there. And I think it demonstrates that the pandemic has shone a light on the existing disparities in our health and in our homes. And then it has exacerbated those inequalities in our health and in our financial security, work security, and in home satisfaction. And that's it. Thank you very much.
Thank you so much, Aideen. I think as ever, so much in there, and really appreciate you getting through all that in that time. I think there's so much in there for people, and we have got a kind of more full version of the slide deck that we're putting together and finalising, which we'll send out to attendees next week, and will be available on our website if people wanted to use and kind of share those slides. Before we move on to the Q&A part of this session, at Aging Better, we really, lived experience is at the heart of everything that we do. And so we'd just like to show you a short video that we've made, just summarising two people's experiences of the past year. And again, please don't forget to post any questions that you have in the Q&A box. Thank you.
We've felt that we've more belonged because we've talked about community more, when we were clapping for the nurses and saying hello to more people. That's a sense of belonging. The village we live in or the suburb hasn't got a community centre. It's very difficult because there's a lot less belonging. You can't meet as much as you'd like to. One of my eldest grandson who's had difficulties in the lockdown, and you can't really meet him. So there is a distance that appears there, which I feel if he doesn't feel it. The youngest grandchildren we used to meet after school as collectors on once a week. And sometimes we haven't been able to do that, obviously, for whatever rules they are. So they've Zoomed us on Thursday, which is really nice. I used to write to my grandchildren every week, letters and stuff. I think they thought I was slightly bad, but...
We were in really, really panic mode and, really worried because we didn't know enough about it. Even now we probably still don't, but we were really sticking to all the rules. I can't really add up how many months we actually stayed at home without going anywhere. It was a long time and it was starting to take a toll on my mental health. All local villages and towns and things get together and get people to put all their ideas, things they want to do, especially now they're getting on the internet more as well, joining together on these sort of meetings, even in the local villages, and all sitting there and discussing what they would like to do. FaceTime is, although it's not exactly the same as actually being there with somebody, but it is nice to be able to. I've got WhatsApp, so I can do my FaceTime and things on there. It's made me realise I do want to do more now.
Thank you. Well, I can see that people are starting to post questions in the chat. So, and I want to invite a couple more colleagues from Aging Better to join us for this part of the session. So it's Christine Oliver, who's a senior evidence manager with a particular focus on communities, and Patrick Thompson, a senior program manager who leads our work on age-friendly employers, so has a kind of a lot to say on fulfilling work. Hi Chris, hi Patrick, great that you can join us. So I'm just going to start. I think we've had a few questions in advance, and I think it'd be really good just to kind of maybe start with some of those. But maybe just, I suppose, Aidine's, your presentation really gave us an insight, didn't it, on the kind of existing inequalities and how they've been exacerbated. I think the first question is a bit of a biggie, but let's take it. What will it take to narrow these inequalities that we see as a result of COVID? Does anybody want to sort of have a go at that from their perspective?
I think from my perspective, in terms of communities, I think it's really important that, given that the pandemic has highlighted the critical role of communities in enabling people to stay in touch, to receive support from others, that's an area we really need to focus on when we're thinking about building back better. So all of the policy discussions need to take that as a priority area for action and to build in the resources necessary to support that in the post-COVID era.
Yeah, thank you, Chris. Aideen, have you thought?
Well, a preventative, a little bit long. I mean, a longer term, the longer term view than Chris's, but a preventative approach to health is really essential, I think. But for the very long term, we have to do better at narrowing the terrible inequalities in health. If the burden of ill health had not been so bad, we would not have done so badly in the course of this disease. And I think also our housing, the state of the housing has truly been, the poor state of our housing has been really laid bare. The fact that the overcrowding, poor conditions that people are living in, it's really dire and shameful. That's something that has to be addressed.
Absolutely. And how about you, Patrick, from the kind of perspective of work?
Yes, so in terms of addressing inequalities in work as we come out of lockdown and hopefully try to recover a bit, I mean, the unwinding of the furlough is going to be key to that, because some of this we still just don't know. We have hundreds of thousands of people effectively in limbo now and not sure if those jobs will be there or not when they come out of it. And I think Aideen's stat in the previous presentation from the Institute for Fiscal Studies about 1 in 8 people who've changed their retirement plans as a result of COVID. That'll really push people in two directions completely. Some people will be, quite hastily replanning their retirement. Savings will have been hit. People will be needing to find more or different jobs as well, just at a time when the economy is really struggling. So I think how employers and recruiters and government reacts to that is going to be really crucial to make sure that people don't get left behind as a result of the pandemic.
Absolutely. Okay, if we maybe move to think of some of the sort of questions that we've had in advance are perhaps on particular topics, so maybe we focus in on some of those. So had a couple of questions particularly focused on digital and how, I suppose, COVID-19 has shaped our understanding of the role of technology in supporting people approaching later life. I don't know, Chris, whether you might have any reflections on that from a sort of communities perspective.
Yes, I mean, I think that the research that we've conducted has offered a fairly mixed picture. I think many older people have acquired skills. They've received help from family and friends in getting online. They've achieved better access to online sources of support and information. On the other hand, as Aideen's presentation highlighted, those on very low incomes have difficulties in gaining access to online support or information. So there's the risk of digital exclusion that I think has been highlighted in the pandemic. And I think that's something that we will need to address moving forward. What are the most effective ways of making sure that everyone has access to the online sources of support and information they need? I think it's been particularly critical in relation to health, because so many people have said that they've had difficulties gaining access to GP appointments because they've moved online, or regular health appointments. That's certainly something that was highlighted in our research in Manchester, where many older people said that they felt that their health had deteriorated because they weren't able to access the services that they'd come to rely on.
Mm. Yeah, absolutely.
I would add just that it seems as if, that there's been increased internet usage, but largely among people who are already doing it. That most older users say their use hasn't changed much at all. I think it stayed about the same. We have some qualitative research that'll be coming out too from that NatSem project that I've been referred to, and there'll be some analysis of digital use there, and people described themselves as being phobic and only being able to use, they needed people to help them, to show them, and they were scared of, anything going wrong, things like that. There was one of the questions which was about internet use, working people, about how staying at home had affected older working people who aren't digital natives. And I wasn't sure about that because I thought that working people probably have actually managed to get digital support during this time.
I don't know whether we have anything further on that in terms of, might we?
Yeah, I mean, the other thing I might add is we've got a project at the moment called the Good Recruitment for Older Workers to Grow project, and that's all about what we can do to work with employers and recruiters to try and de-bias some of the recruitment process particularly. And what was really interesting we found in that is that for many people, it isn't so much often their age, it is the fact that they haven't applied for a job for maybe 10, 20 years or so, and are less familiar with the current processes. So a lot has changed in recruitment over recent years, and particularly with many people now doing it and having to do it remotely or via Zoom and things like that, often also using technology like AI and that kind of thing. And what we found is that in and of themselves, those bits of technology, they don't have to be good or bad. It's really how people use them as well that matter. So it's still a lot of the attitudes and perceptions of the hiring manager or the organization doing it that makes a big difference. But at the same time, we have to reflect that for many people, they might not have applied for a job for a long time and are not so familiar with the latest ways of doing that. So employers also need to be supporting people through that process as well.
Absolutely. And I think, back to the sort of community point, we've seen lots of really good examples, haven't we, of community organisations supporting people to get online and finding creative ways to help people access Zoom or to be connected. And I think through some of our work in Leeds, we're sort of seeing that some of these things may well sustain, so that if actually people feel it's difficult to get out they don't want to be out an evening, or if the weather changes, that actually you can carry on with some of these Zoom connections alongside physically meeting. So I think there's also some really great examples that we're sort of seeing across the country of people being able to be more supported to use this technology, particularly to connect. Okay, I'm going to move us on to sort of some interesting questions, a couple of questions actually here in the Q&A box, I suppose, about the priority or otherwise being given to older people in terms of the recovery. So the whole conversation about recovery at a national, local level, and people feeling, question here from Tim Whitaker, saying the key issue is the political priority being given to older people in terms of the recovery. There's a lot of evidence about hardships, like we've heard today, but it's not unsure whether it's getting attention. And again, another question here from James, why do you think older people's issues seem to be always down the political agenda? Does anybody have any kind of reflections on that, really? I suppose whether you agree with that, and whether there's things that we could do to kind of shift that.
I certainly think that there was some data in the Ipsos work that showed that older people did not feel that they were being consulted or considered in the efforts to kind of recover. So that is a feeling among people themselves, actually. Yeah, I would agree with that.
And I might just add from a work in the economy point of view. I mean, a lot of what will make the headlines and what we're seeing in the data as well is that the economic impacts have been truly devastating for for the very youngest, particularly, you know, you look at under 25s or under 30s, it has been a really, really bleak picture because of the type of sectors that people work in. And I suppose it's not useful to anyone to pit one age group against another. So I suppose it's just to highlight as well that, you know, over 50s, over 55s, and over 60-year-olds have also really struggled there as well. And some of the impact will be longer term as well, because we know probably the bigger issue there is people who are made redundant are long-term unemployed, which you're more likely to be the older you are, and then struggle to return to work as well, and often move into early retirement. So I suppose it's the way things are portrayed in the media. Often they will pick out one age group particular to focus on, but there are many, many people really struggling. And I think, unfortunately, a lot of the pain is still to be seen.
Mm.
I also feel that, yes, it's not very helpful to focus on intergenerational conflict or difference when, if you take another perspective of the life course, many of the people who are struggling in their 50s and 60s have probably struggled for most of their lives. So you see disparities across the life course that accumulate. And I think that that's one of the reasons, again, why we have these so high levels of prior health conditions, differences in employment rates, security of employment. So if you take a life course perspective, I think that's far more useful in terms of analysing inequalities and thinking about how we can intervene.
Mm-hmm. Okay. So what about a question here about, are we worried that people's retirement intentions are changing? So some of the kind of, and do we think as an organisation more people will be living in poverty in later life as a result of COVID?
I mean, I suppose just a quick one of that is that, with everything else going on, we've also seen the state pension age go up to 66 in this same period for both men and women. So it's the impetus there is them more than ever. And I suppose it's just, we've got to make sure that those inequalities don't mean that people are either left hanging on for a state pension age, which increasingly feels further away, or the people who are most reliant on that state pension are not able to save in other ways for it as well. So I suppose it is, now it is more important than ever, I would say.
Yeah, and I think we'll have some work coming through. We're doing some research at the moment with the Pensions Policy Institute, trying to look at what is an adequate income in retirement, and also how many people we think will meet that level of adequacy. And on top of that, what we think the impact of COVID will be. So I think we will also, as well as the kind of research that we're talking about today, the other research for us we've got that might have more of an eye on the future. I think hopefully we'll be able to kind of answer some of those questions with more data, I think, in the coming months.
And actually, Claire, just add one more point, just because I really hope this isn't all doom and gloom as well, because what we have seen through talking to employers and people in work as well is that for some people, they've tried to take the positives where they can with this. And say in the world of work, the move to remote or flexible working has suited some people really well. And I think some people have really valued the fact they haven't had to have long commutes. They have been able to spend more time at home if it is an environment that suits them well. So it's just, and that's certainly not all, but for some people, it has actually, they've reevaluated things and thought, I can work for a little bit longer. This does feel more manageable, but obviously there are still inequalities within that as well. And I think it's only 10% of the bottom half of earners say that they could do their job remotely. So there's always inequalities in that. But for some people, this could be a way of extending working lives and also making it feel more sustainable as well.
Yeah, I think that's a really important point, Patrick, isn't it? And also one question here, I suppose, that relates to that, I suppose, are the kind of things that we see are needed to support older workers. Do you want to kind of build on that, Patrick, and just talk about some of the examples that we see that employers could things that employers could do now?
Sure, yes, and some of these were true pre-COVID as well. I mean, we look a lot and have always promoted good quality flexible working as being one of those key things that can support people to work for longer. But again, as I mentioned previously, it's all about the access to that as well. And people, need that for a whole range of reasons, whether it's balancing with caring or with having a long-term health condition or just wanting a better work-life balance. So that's one key thing that we've got a toolkit that we've developed with TimeWise that can help promote good quality flexible working. Other things that employers can be doing, I mean, more broadly, just sort of considering and rebalancing ageism within workplaces as well. We know it is sort of one of the last isms that is still, fairly widely accepted or not thought about very much in the workplace as it is in society. So the more employers can be thinking about that and how that affects their recruitment policies. We've put out some research recently showing that 1 in 3 workers in their 50s and 60s feel that they've been disadvantaged in the recruitment process because of their age, which is about twice what it is for younger age groups as well. And it's around, all these kind of things that there's still a perception that employers say or think that older workers might have too much experience. So it's just trying to burst that bubble slightly, that a lot of these stereotypes are not based on anything in terms of the reality or the evidence. And ultimately, the employers end up losing out by not getting these good recruits or not holding on to people for longer as well. And I think final thing around, making sure that career development, training opportunities, they continue to progress just as much as you're in your 50s and 60s as your 20s and 30s. At the moment, vocational training does fall off a cliff a little bit from your 40s onwards. And I think with many of us needing or wanting to work for longer, we need to try and address some of those things for individuals' benefit, but also for employers and the wider economy.
And Aideen, on the sort of health side of things, we sort of question about what are the main things we can do to support people in later life to sort of to stay healthy and to prevent ill health. What ideas are there, I suppose, in terms of what people can do, at this time, as well as obviously in the kind of longer term?
Well, I mean, I didn't mention this one, but we have a report on the website that we did with the Physiological Society that you could look at, because while health behaviours have deteriorated and there may have been detrimental effects for many people, it will have been particularly bad, and we probably all have no examples of this, but for much older people who really are not able to cope with or bounce back from reduction in deterioration in muscle mass, and that can really lead to frailty and really serious adverse long-term health outcomes from which they will really struggle to bounce back. So that there is a report on the website, and it does talk about we make recommendations that there needs to be a sort of COVID kind of strategy for helping older people to come through this, and it involved exercise and diet and dealing with loneliness and making sure people are staying in contact, because mental health is a big part of it too. So that's a really critical thing to do. So yeah, we do recognise that that's especially for the oldest in society, that's a long road back.
Thank you, Aideen. I think we've probably got time for one more question, so I'll take this one that's about older people's engagement in volunteering. So Annie here is saying they've introduced some new services, which means they're able to get more older people engaged in volunteering. However, the opportunities are still easier for the more well-off to get involved. Do we have any suggestions or thoughts around that?
I think that is a problem that's come up in our research, hasn't it? That older people who are better off have more time. They're time rich as well as being resource rich. And that then becomes a bit of a circular problem, because they get involved in volunteering, and then there are the personal, emotional benefits that are gained from volunteering. And I think that's something that we're starting to look at now, formal volunteering, how can you make it more accessible, more flexible? Do people on low incomes actually have the time to get involved? What would make it easier for them to be involved? But at the same time, I think we tend to ignore the fact that that's formal volunteering, but they may actually also be involved in helping out those where they have existing relationships, so friends and family. So it's not that people on low incomes, poorer people generally, are not helping out. I think that's a bit of an assumption. I think it's how it happens and what are the mechanisms at play that we need to try to understand about how people on low incomes are receiving and giving support that might be invisible to us. And maybe they have preferences for staying with helping those that they know in communities that they know, rather than formal volunteering in organisations, which is perceived to be very much an activity for middle class people on adequate incomes. So I think that there are lots of complex factors involved in that pattern that we need to sort of understand first of all.
Yeah, absolutely. And I think, like you say, what's visible and what's not visible in communities. Yeah, and I think we've done quite a lot of work that's focused on us as what we've called kind of age friendly volunteering. So again, trying to look at ways in which organisations can address some of those barriers. So we know they're, like Chris said, very real, cost barriers, financial barriers, aren't there? But also this kind of issue of time and of confidence and how flexible volunteering opportunities can be. So hopefully some of that material on our website might again be some useful examples of where people have tried to do this in practice, and some tips, I suppose, in trying to think about how to make the volunteering opportunities you provide as an organisation more age friendly. Okay, I'm so sorry. There's so many questions. I feel like we could just sit here for another hour, couldn't we? And kind of talk about, there's so much in this. But thank you all. I mean, thank you, Aideen, for your brilliant presentation, and for Patrick and Chris and Aideen for joining the panel discussion. I feel like we've got through a whole range of issues in the last hour, and I hope it's given you all something to think about, and maybe I can tell by some of the questions and comments that some of what we've presented today really obviously resonates with the work that you're doing in your organisations and communities. So yes, a virtual clap for my wonderful Aging Better colleagues. I'm sure everybody else will be doing the same. So as I said earlier, the slides that Aideen presented are part of a wider deck that we're just finalising and will be available on the website next week. So again, hopefully that's a useful resource. And I could see quite a few people saying, "Oh, can we get the slides?" Where really useful information. So hopefully that's a resource that you can use, and we will send that out to all attendees, so please look out for that and hope it's helpful. We always like to make a little bit of a plug for what we're doing next at the end of each of these. So the next Aging Better webinar is going to be on the 31st of March, which I think is next week. We are at the end of March, aren't we? And that's kind of really related. I suppose it's about housing and our health and well-being. So again, if you're interested particularly in housing and health, then please do join us for that. And there's a link in the chat, and also there'll be details on our website. And really, we really would welcome, any thoughts or feedback you've had on this webinar. So again, there'll be a link to how you can give feedback to us. We really, really appreciate that in the chat. But otherwise, it just leaves me to say thank you all so much for joining us, and hopefully we'll see you on a webinar soon. Bye.
Bye, everyone.